Today I wanted to talk a little bit about pain. As you know, it is our favourite topic. And I wanted to talk about the fact that all pain is real today. And I hate having to say that, and it's the nature of where we've got in the sort of the latest pain science that parts of the world, the community, the medical profession have got wind of and have got ideas about the fact that actually there is an element of pain that comes from the nervous system. But how this is being interpreted is that it's all in your head, and it's like that you're imagining it, and that isn't true. And it's so often people come in to see us and they'll say, but are you saying it's all in my head? So you're saying it's like a somatic? Are you saying that I'm imagining it? No. But we may gently challenge your understanding of why you think that you have that pain, or what tissue it may be related to, or what's going on. So all pain is real, and it is not in your head. But probably around 85% of chronic pain, so this is pain that has been there for more than 3 to 6 months, actually does have a neural component. It is coming from a pattern that has developed within the nervous tissue, not within the tissue, but within the processing of the nervous system. So essentially, there is a neuroplastic, a neural circuit aspect to chronic pain. And understanding this is really, really important. Because if we, particularly as physical therapists, continue to treat you with, oh, well, your muscles, then you must have strained your muscle, you must have, strained a ligament, oh, your muscles are really knotted up, oh dear, there might, you had a disc bulge 20 years ago, it might be that. We're doing you a disservice if we sit with that narrative, because the latest evidence shows us that actually, usually within 3 to 6 months, pain from tissue damage is healed. So once we have ruled out that you haven't got a fracture, that you haven't got some sort of pathology, that you haven't got an infection, there's no cancer or anything in there, then very often, even if you've had an injury, the healing of that should have mostly occurred within the first 3 months. Even if you break your arm, you have your arm in a cast for 6-8 weeks, and then generally you're better again. And actually, very often, if it heals well and there's no complications, then you don't have any pain ongoing. And it is the same with chronic back pain, whether it comes from an original injury or whether it actually comes from a sort of an unknown event, or even there seemingly to be no event. Then we know we have to consider that there is a neural circuit aspect to this, which is, as I say, it's a little bit like thinking about your body and your nervous system as a computer. So there's actually, if you've got chronic pain and we've ruled everything else out, and you're 3 to 6 months post-injury, if you've had an injury, then it's like a computer. Basically, your computer is functioning fine. There's absolutely nothing wrong with the hardware. The computer itself is working great, but there's no damage to it. There's nothing that needs replacing. But there's a glitch. There's a glitch in the software. There's a glitch in the way that the system is running. And this is the same in a chronic pain situation. And this, I think when we talk about pain and we talk about this, we have to be really careful about the language and how we explain it, because it leads to a huge amount of frustration, annoyance, and anger if it seems like we're implying that pain is in your brain and that you are imagining it. The only way you can have pain and it not be really pain is if you are lying about it. And people don't do that when they're in pain, because essentially they'd really like to not be in pain. So essentially, if you have pain, there is a reason for your pain. It may just not be quite the reason that you thought it was. And it's not your fault that you have pain that is coming from a neural circuit disorder. There are so many factors that can be keying in to that as to why you have a long-term persistent pain condition. And most of those things will be outside of your control. They will be due to possibly even as far back as childhood, adverse childhood experiences. They may be due to previous stressors. They may be to long-term stressors. We have to consider the fact that you have had an injury and therefore a pain pattern in that area possibly preceding this event. We have, for instance, priming events, things that happen a long time ago, and then a secondary event that is the triggering event to the pain then becoming persistent. So there's so many reasons why you might have pain that is ongoing and it's not your fault. Also, as I briefly mentioned before, some of that can be your belief about what the pain is or why the pain is there, and that is unfortunately perpetuated by health professionals sometimes. So we have to be really cautious about what you believe your pain is there, not in a sort of a religious belief way, but in your understanding, your concerns. So one of the questions we ask in the clinic is, what is your worry that your pain is? What's your worry about your pain? What's causing it, or why it's there, or what it is? And actually that's a really enlightening question to understand what you perceive as the danger with regards to what your pain is. And I think it's a new question that we've started asking in the last couple of years, and it's really, really key to why sometimes people's pain is persistent, because they've got a huge worry that I've got a disc. My mother had a disc, she ended up having to have surgery. My father had a hip replacement and it went wrong, and therefore I've got pain in my hip that's persistent. So those things are all really key and important to understand. They also may not be relevant, but it is important as to why, when we take a mind-body approach to your pain, we ask you many, many more questions than just, where is it, what makes it better, what makes it worse, when did it start? Those are important questions, but essentially we explore that a little bit further. And interesting enough, the other thing about pain is it's sometimes serving a purpose for us. Sometimes we need to have pain so that we don't go out. I know that sounds silly, but sometimes the world feels too overwhelming. Sometimes we'll feel too tired to engage with it too much. And so actually our pain sometimes is doing us an enormous favour. It is really trying to help us stay safe. It actually means that our life gets very small, but it wants to keep us safe. And so that can be another reason for long-term persistent pain. And again, this is not your fault. This is your nervous system trying its absolute best to keep you protected, to keep you safe. But when you have pain, what you need to sometimes ask is, why might my pain be helping me? And sometimes that's you can just ponder on that and see if there might be a reason why your pain might be helping you. The other thing too is a lot of pain can be related to emotion and trauma, but interesting enough, the emotion we don't often connect together. And so we in practice do an emotional awareness technique that helps to see whether there's any emotional holding behind the pain that you've got. And very often there is. And again, a question that we ask, would you prefer to have physical pain or emotional pain? And personally, I think quite often emotional pain is more uncomfortable than physical pain. And so actually we're choosing to be, well, not choosing, actually that's really the wrong language. I do apologise. Our nervous system is thinking that actually to feel physical pain is preferable to feeling emotional pain. And sometimes we are keeping those emotions down, we're keeping them repressed and suppressed because they are so uncomfortable that we don't want to look at them. When we learn a way of looking at them in a safe and supported environment, which is one of the things that we do with our clients, actually releasing those emotions actually can have a profound effect on the levels of what is seemingly physical pain. And pain also does feel very physical, and it's often triggered. People say, well, it's triggered when I walk, or it's triggered when I do this or that, the other. And that is absolutely true, because essentially whenever you move a part of your body, there is a information that is going back to your brain to tell you that piece of your body is moving and where it is in space and what you need to do, to do with it. And so there's always information passing backwards and forwards. And in the situation with chronic pain, what becomes apparent is that then those signals are then tinged with danger. So when they get to the brain is still going, oh my God, you moved that part of your body, that's really dangerous. It might be because actually I think I might have a disc injury there. So essentially we end up with an overactive sort of alarmed nervous system. It's a little bit like you may again have had an injury initially, and that's like when the smoke alarm went off because there was an injury, there was like the fire or the smoke, and so the smoke alarm started beeping at that point. Now, often 3 months to 6 months later, you're in a situation when you don't have the injury anymore, or even if you didn't have an injury, that it's not there anymore, but the smoke alarm is still going off. There's still this elevated level of danger in your brain related to movement of certain parts of the body. And what we need to do with treatment essentially is to identify and to turn those situations down. And that makes an enormous difference to how people's pain then persists. And this latest sort of neuroscientific pain knowledge is ever emerging and has really been coming out over the last 10 to 15 years, but is not necessarily being taught across medical schools and to all health professionals, including osteopaths. And that is partly why we're so passionate about sharing this information, so that we know if you come to us, we're going to make sure that we rule out all the red flags, all the things that we need to rule out. And then we're going to look at exploring your story. We call what's in your backpack. What is in there? What else is in there that might be influencing your situation? And then we have lots of tools and techniques to help you unpick and unpack that, as I say, using all the latest scientifically based tools and techniques. But the message I just want you to take away from this is, if you have got long-term chronic persistent pain, it is not in your head. It is not your fault. It is real. We understand it. And there is hope for recovery when we look at it from a mind-body perspective.